Let's talk about an important topic, hereditary hemochromatosis, in this video. Hereditary hemochromatosis is an autosomal recessive disorder. It is due to the abnormal accumulation of iron in the various parenchymal organs. Iron gets deposited in various organs of the body. That is the main pathology of hereditary hemochromatosis. So when iron gets deposited in various organs, so symptoms related to those organs come into play. So if you understand that, you'll be able to answer. So in symptomatic patients of hemochromatosis, total body iron is around 20 to 40 grams. It is 3 to 4 grams in normal individuals. Hemochromatosis is associated with high incidence of hepatocellular carcinoma, HLA-B3, B7 and B14. His histocompatibility antigens, like people with HLA-B3, B7 and B14 have more chances of developing hereditary hemochromatosis. So excess of iron is deposited in liver, heart, pancreas, endocrine glands like the pituitary gland and the skin. So when iron gets deposited in these organs, the clinical manifestations of the disease are related to these organs usually. Coming to clinical features of hereditary hemochromatosis. So most frequently males are affected over the age of 40 years. Usually patients present with constitutional symptoms like muscle ache, joint pain and abdominal pain. So hereditary hemochromatosis, there is one triad. So what is the triad? It is bronze skin hyperpigmentation, hepatomegaly and diabetes mellitus. It is also known as bronze diabetes, right? So skin hyperpigmentation is due to deposition of iron in the skin, hepatomegaly because of deposition into the liver, diabetes mellitus due to deposition in the pancreas. So the diabetes due to hereditary hemochromatosis is also known as bronze diabetes. The late features of the disease are hypopituitarism, loss of libido, testicular atrophy. If it gets deposited in the heart, it will produce cardiomyopathy, hypothyroidism, cirrhosis with hepatosplenomegaly, very important. Spiders, I'm sorry, this is spider nevi, loss of body hair, jaundice, and ascites. Most important is cirrhosis. So these are all the clinical manifestations of hereditary hemochromatosis. So coming to the complications of hereditary hemochromatosis, one is, as discussed earlier, high incidence of hepatocellular carcinoma. Yeah. Then chondrocalcinosis, that is asymmetric deposition of calcium pyrophosphate. Just give me a moment here. It is abnormal deposition of calcium pyrophosphate in both large and small joints, leading to arthropathy, leading to joint pain. Right? If it is deposited in multiple organs, ultimately it will lead to MODS, multi-organ failure. So this is a very important MCQ. So susceptibility to specific infections like bacteria whose virulence is increased by the presence of iron. So those patients are uh, patients of hereditary hemochromatosis are susceptible to infections whose virulence is increased by presence of iron. What are those organisms? Those organisms are Listeria monocytogenes, Yersinia enterolytica, and Vibrio vulnificus. So these three organisms, the virulence is increased by presence of iron. So in patients of hereditary hemochromatosis, the chances of infection by these organisms is more, or specific you can say. The investigations to be done in case of hereditary hemochromatosis, very obvious is serum iron profile, genetic studies, CT scan shows increased density of liver due to iron deposition, MRI is sensitive to direct iron content, and screening of, very important, is autosomal recessive disorder. So screening of first degree relatives for hereditary hemochromatosis is very important. So coming to the treatment and management of hereditary hemochromatosis, treatment usually should be started before permanent organ damage sets in. The main treatment is phlebotomy, in which around 500 ml of blood is removed, which removes around 250 mg of elemental iron. Uh, Chelation therapy by desferoxamine, treatment of various allied diseases caused by deposition of iron, that is diabetes, congestive cardiac failure, and cirrhosis. Dietary restriction of iron intake. Intake of substances that reduce iron intake should be increased. So there are certain substances like phytates and phosphates which iron binds and decreases the absorption of iron. So such intake of such substances should be increased. Citric acid increases the absorption of iron. So vitamin C or citrus intake should be reduced in case of hereditary hemochromatosis. So these dietary changes are very important to take into account while considering these patients.